Welcome to Up to Speed, Baker Tilly's automotive industry podcast. I am your host, Mike.mader, the dealership industry leader for Baker Tilly. Up to Speed serves as the automotive industry's connecting point to have conversations from industry leaders regarding topics pertaining to tax, accounting, and automotive operations of a retail dealership. We arrive in your mailbox the third Wednesday of every month. If you would like to listen or view past episodes of Up to Speed, you can find them at our website at bakertilly.com/dealerships. In the dealership world, there's a number of expenses that can take some creativity and discipline to manage. For example, floor plan interest, payroll, advertising, and employee benefits. These are some of your bigger ticket items. One particular aspect of employee benefits that is seemingly out of control is healthcare insurance. Healthcare costs are expected to continue rising in the coming years. According to the Centers for Medicare and Medicaid Services, national health expenditures are projected to reach $6.8 trillion by 2030. This represents an increase of 43% from 2022. On today's episode, we're going to discuss ways of gaining some control over your healthcare expenses through cost reductions, as well as enhancing your culture toward healthcare, improving retention of your team, and ultimately with the goal of increasing the bottom line. My guest today is Keith Lemer, the CEO of WellNet. Celebrating their 30th anniversary, WellNet Healthcare has built a high-touch, hospitality-driven third-party administrator service model for self-funded employers. Keith, welcome to this month's episode of Up to Speed.
Thank you, Mike. Thanks for having me. Appreciate it.
Yeah, it's great to have you here. So, we've got a great topic today, as trying to get control of healthcare costs is always top of mind for dealerships in the industry. So let's dig right in. So with the continued rising cost of healthcare, many have described our healthcare system as broken. What's your take on this, Keith?
It's interesting. Everybody says the system is broken, right? It's not broken. It works just fine. And it works just fine for those that designed it, right? To keep the revenue streams intact. You've got the carriers, you've got the pharmacy benefit managers, you've got those that are advisors and consultants. And the more that a group spends, whether it's an auto dealer or any other company that they spend, the more that those entities make. And it's simply not those folks' business model to look for cost containment solutions, right? What they're there to do is to provide access, right, and claims administration. And if you think about what dealers are trying to do, right, and how they operate and manage their business, they look at every single line item of their company, right, with a fine-tooth comb. They manage it, they measure it, they report on it at the end of the month, how many cars they've sold, how well the F&I is doing, every single item. The only area that we see a lot of dealers overlook is their health insurance cost. And to us, it seems to be the number one negotiable operating expense that really could have a big impact.
Wow. So they're in the business like everybody else to make money. So their goal is never to reduce the healthcare costs.
Correct. They say that, they have cost containment solutions, but when have you ever talked to a customer, right, a client of yours, and said, yes, this is the first year we've seen our healthcare costs go down? That traditionally is not the case. What typically happens is the renewal comes right after 10 or 11 months after the group has been operating, and the broker advisor comes back to the employer and they say, hey, you've had a good year, right? Your renewal increase is only 10 or 15%, right?
Right.
Instead of 30 or 40, of which knocks the eyeballs out of most people, right? You don't have any other business expense that goes up, whether it's 10 or 30 or 40%. And so what typically happens is they say, the CEO or the CFO or HR director of that employer dealer, they go back and say, can you do any better? And so the broker advisor, right, comes back to the dealer and they say, oh, you know what? We've got such a great relationship with the carrier. They've knocked the renewal down to 5% or 8%. Meanwhile, everybody that surrounds the plan still got a 5 or 8% increase, right? In their compensation, right? The carriers make 5 or 8% more. The broker makes 5 or 8% more. The only people that lose is the dealer as well as the employee, because in many cases, the dealer is not willing to digest that increase and they will pass along or cost shift to that employee. And so it's very challenging. And instead, when you do get a renewal that's in the 5, 8, or even 15% range, that's the time to say, wait a minute, maybe we're actually healthier than we think. And many of those groups, they may be fully insured, right? Paying premium every single month. Maybe it's time to consider self-funding. And on the flip side, right, if you're self-insured already, there are many opportunities. We kind of look at it as, self-insurance is really just the place to start, right? That's the beginning of a journey for cost containment solutions. And I know we can spend some more time talking about that.
Yeah, it's kind of funny because I used to work in industry before I got into public accounting, and every year you state the renewal comes up, and yep, you're exactly correct in this, how you stated it, that you know what, you guys had a great year. Your expenses, your healthcare expenses were lower than what was anticipated, so your premium's not going to go up as much. That's exactly what we heard just about every year. So, our healthcare system faces a lot of challenges. Some of those, the inefficiencies, the accessibility issues. From your perspective, what's something that most people really don't know about the healthcare and healthcare insurance industry?
This is the biggest misnomer. And I'd say this, right? Whether you're in Minnesota or Dallas or South Florida or New York City, every single doctor gets paid something different for the exact same procedure. I'll give you an example, right? A knee surgery in Dallas, Texas could be $80,000 at one facility, and 3 miles down the road could be $20,000, right? A $60,000 delta. The carrier, right, will never tell an employer and an employee where they can actually go for that high quality, fair cost service. Their responsibility, the carriers, right, is to tell you we've got 500 doctors in our network that do XYZ procedure, right? They want the most doctors in that area to provide those services to the employee. And at the end of the day, because the employer is paying the cost of the claim, the higher the cost of the claim and the more claims, the higher the premium is, and the premium increases are at the end of the year. But what if, right, you could figure out a way to let your employees know, hey, listen, the doctor at that facility 3.5 miles down the road is $20,000, right? A $60,000 difference from the $80,000 one that you were typically going to go to. And instead of us, right, auto dealer ABC saving 60, how about we as the employer decide to waive your deductible of $2,500, right? The employee gets, in essence, free health care for that knee surgery, and the employer saves 57,500 instead of saving 60, and they're still going to that high quality, fair cost provider. Those are things that the insurance companies do not and will not ever relay to the employer and to the employee group.
Well, that seems like it's the employers actually taking more of a proactive step in managing their healthcare spending, along with cooperation with the employees themselves. Is that your take on it versus being reactive?
It is, it's interesting. I have a friend of mine who is a spinal surgeon at Georgetown University Medical Center, a MedStar facility. And he had a patient coming in town from out of the country who didn't have insurance, who needed to see him for this spinal procedure. The spinal procedure at Georgetown was $180,000. The guy, again, had no insurance. And he says, is there any way that you can perform this surgery for me, but at a different facility? The doctor goes back, he checks with the, health system, and the health system says, yes, we can do it 8 miles down the road. Guess how much the procedure was now? 8 miles down the road, same physician, started at $180,000.
I probably can't even imagine. I'm going to assume to throw a number out there, 80,000.
No, how about this? 1/10 the cost,
Wow. Oh
$18,000,
my
right?
goodness. That's
That's how
crazy.
much waste and inefficiency is in the system. And so what we're really talking about, going back to your question, is CEOs and CFOs really need to take an active role in lifting under the hood to find out what's right, what's wrong about the plan. At the end of the day, right, and when we look at what even Baker Tilly does, you guys advise your clients on tax and estate strategies and a variety of accounting items, right? You are there to protect the dollars of your employers so they pay as little tax as possible, right? There's nobody that's really focusing on the same type of approach for the employer when it comes to health plans, right? The carrier, that's not their job, right? And they don't really desire to do that. And the brokers and consultants, they're very good, but what they typically do, and I'd say unfortunately, is they're great at going to 4 or 5 different carriers, shopping them, right? Putting them on a spreadsheet, picking the lesser of the increases, setting it, forgetting it, and renewing it, right, until 10 months down the road. In order to take an active approach, and again, going back to Baker Tilly, you guys are meeting, talking strategy with your clients, providing ideas. That's the same type of approach that needs to be done in the health plan sector, especially that it's the third or fourth biggest line item, as you mentioned earlier.
Yeah. So, many dealers are already self-insured. Some of our larger dealer groups are self-insured. So why is this, how do I state this? Why should they be seen, or why should this be seen as a starting point for cost savings and improvements rather than kind of the ultimate solution? It sounds like it's a process that needs to happen.
Absolutely. Again, self-insurance is a launching pad because, yes, you're moving a lot of the profit initially from the fully insured plan to the self-insured plan. But now that you're self-insured, you have data, you have transparency, you have analytics. You can find out where some of the inefficiencies are in the plan. You can be proactive versus reactive. And I'll give you just a couple of examples, right? There are about 30 different areas of cost containment solutions that you can implement. And I'll give you one for Oarsman Automotive. They have about 500 employees on their plan. They've got about 25 dealers in the Mid-Atlantic region, right? A mega dealer of sorts. And they had about 50 people on their plan that could be moved to Medicare. Those members, right, are costing about $10,000 on average. Now, you can't force anybody to go to a Medicare plan, but you can educate, you can guide, you can advise. And in doing so, we were able to get 25 people off the plan and move them to Medicare, saving without even any difficulty $250,000, right? That's
Wow.
massive amount of savings simply through education. Or you take a group like Lindsay Automotive, right? They're also in the Northern Virginia region. Lindsay Automotive, they had several members that needed dialysis. If you can find a dialysis carve out network, right? Like a dialysis PPO. Dialysis is a $250,000, $300,000 on an annual basis for treatment. If you can find a dialysis carve out network, right? Same doctor, same facility. It's simply another way of adjudicating or paying for the claim. You can get that $300,000 knocked down to about $75,000
Hmm.
to $100,000, right? And there's lots of different areas like that. And lastly, Belize Automotive, MRIs can be carved out from 5,000 to 500, taking drugs like Humira that are $80,000 a year and getting them for 40 when you source them differently. It's simply somebody minding the back of the store. And so dealers, right, they're pining for solutions like this. Their employees are asking. And typically, right, when people are asking for help, right, they don't have one question. They have nine
All
different
right.
questions. That's when they need the most amount of assistance. And so it really takes dealers that are forward thinking, that are about culture and retention and really want to improve their operation. And most important, right, outside of their real estate, right, and their cars that they have in there, and I almost say secondary, their employees, they are their most important asset. So why
Absolutely.
not invest the time and the energy and take that knowledge and lift under the hood?
Yeah. So you mentioned on you can't force an employee to go on Medicare, and typically the employer's health insurance plan is usually going to be better than what Medicare provides. So how do you incentivize or encourage an employee to get into the Medicare plan versus staying on the insurance plan of the employer?
So it's really just about education because sometimes the Medicare plan may be equal to or better than the actual plan offered by the employer. We've seen that in many cases. And so there are teams of individuals, right? Let's call them advocates that go in and say, here's your current plan, right? Here's your deductible, here's your copay, here's who you can see, and here's who maybe you can't see. And oh, by the way, we've sussed out some of the Medicare plans in your region. And oh, by the way, you can actually go to this hospital, which may be an A plus versus the B
Mm.
plus that you were traditionally going to, as well as maybe some of the co-pays and premiums, right, that you have to contribute to could be less money. So it really is an educative and consultative process that, again, the carriers are not doing. What they're offering, right, the carriers is they bring the network, right, the medical access, the pharmacy, the stop loss. And so they're making revenue streams on every single one of these items. And that's really causing challenges because nobody's lifting under the hood, looking at that data, making the recommendations, the suggestions to do these things. And so it becomes quite difficult to really get your hands on the plan. And that's why, Mike, and you've probably talked to some of your clients about this, every 4 years, their healthcare costs have doubled on average.
Yeah. Yeah. So essentially you're doing a side-by-side analysis of the plans for the employee to see, hey, this is what one is the best one for you to be looking at.
Absolutely. Absolutely.
Okay.
Again, you have that. When you're self-insured, you can use that kind of data. But when you're fully insured, you get very little information, right? You may get top 25 claims, that your plan utilized, and maybe some high cost procedures and things of that nature. But you're not getting all of the claim data to dig into again and go back to what I had mentioned earlier. See what's right, see what's wrong, see where there are areas of opportunity. And again, we kind of look at this as like a crawl, walk, run approach, right? Every customer, every company, right, has their own culture, their own pace, and their own desire to save. And some want
Mhm.
more quickly opportunities to save, and some want to keep things just right. And so if you come back and you make recommendations to a group, right, typically most groups like to mirror their plan, right? When they go to
Right.
a managed self-funded offering. And then when they see they can actually kind of tighten the screw without difficulty and more education to the employee. And that's the key right there, right? It's the
Mhm.
education to the employee. It's the endorsement from the executive group, that executive sponsorship. Like, we're doing this, right? We're not coming down on you. We're not taking anything away. We're trying to make you healthier, and we're trying to keep more money in your pocket. And so when we can do those things, the opportunity to manage the plan is kind of limitless, right? A managed self-funded plan typically saves about 30% more dollars than an unmanaged self-funded plan. I mean, so you're talking massive savings.
Yes, absolutely. So, you're talking self-insured groups. In the dealership world, usually there's typically a minimum number of employees that you need to look at in order to spread that risk appropriately. So, what are your thoughts on this, and when should a dealer look to become or take on the self-insured portion?
Yeah, great item you bring up. So, typically, right, and looking back historically, self-insurance was scary for some people, right? Maybe they'd self-insured 5 or 10 years ago and their plan blew up. Today, there's so many more opportunities to self-insure with budgetable premiums, with guardrails, as we kind of call them. So, we typically like to see groups that are about 100 employees and up. And many of those groups that are 100 employees and up, they do something called level funding. So, it is self-insurance with training wheels, where it is budgetable premium dollars, but in essence, you're paying claims, and the dollars that you don't spend with those budgetable premium dollars, you then actually get returned at the end of the year 100%. And then those groups that are typically a little bit larger, let's say 300 employees or 500 employees and above, they are self-insured, without those training wheels, and they pay claims as they go. You can still take that expected or max cost, right? That maximum amount of spend, and turn it into a premium equated rate. So you too, whether if you're 1,000 employees or 3,000 employees, you can have that budgetable item. And then again, kind of reconcile at the end of the year. But again, we typically see it's about 100 employees and above. We do have some groups that we've managed, for many years that are 50 or 75, but at the end of the day, it's typically about 100 and above, Mike.
Okay, all right, perfect. Thank you. So, you mentioned earlier how in part of your explanation and something that it would build a stronger workplace culture to be self-insured and to help. Can you explain or go into a little more detail on that?
Yeah, so think about this, ready? Every year you do the renewal with your health plan, and every year you come back to your employees, you say, oh, gosh, it's been a tough year with healthcare, right? Everybody reads the paper, they know what's going on, they've had personal issues themselves, and they get a 15, the company gets a 15 or 20% increase, and now the employees are getting 15 or 20% more cost for their premium contributions. They're not happy.
Right.
Imagine if you go back to the employees and you say, hey, listen, our plan's been running really well, right? You all have been doing a great job participating, educating, advocating, working with our partner. And you know what? We've saved a lot of money. So we know what we're going to do. We're going to waive your employee contributions for 3 months. And not only because this has been running well this year, this is now the third year you've heard that message from me. We've now waived your employee contribution, which is about $900 for company ABC, right? A dealer, Carter Myers Automotive in Charlottesville, Virginia.
So you've
Um,
actually seen this in effect?
Oh, without question. And here's the best part about it, right? Not only did these associates get $900 per month, right? $2,700 for the year, in essence, waived to them, the tears, right, of joy, what it does for culture. And this particular dealer, Liza and her team, they have about a 50% recruitment rate comes from the employees in their company recommending others. And their turnover is some of the lowest in the industry
Wow.
because of how they're taking their approach for their health plan. I've never seen it before with any other dealer client, and frankly, any of our other clients in other industries.
I mean, that's a great way. If you can share some of that savings with the employees, they just appreciate it so much more.
Without question. And now what happens, right? The employees are vested, right? They're not just like thinking they have a an American Express card and it's all you can eat buffet for your health plan and not thinking about it. They'll actually ask questions. Where can I get that less costly drug? Can I get that wrist surgery at a lower
Right.
cost ambulatory surgery center? Can I go to a different facility for a procedure? They're asking questions because they care, and it's really done in partnership with the employer.
Yeah, so they're buying into the whole plan because they know there's that opportunity for them to, I'm going to say, fill their pocket a little bit with reduced healthcare costs.
Absolutely. It's
That's
about culture, retention, risk mitigation, and it really does make for a successful business.
so that's pretty awesome. But let's turn the page just a little bit. So I mean, we often talk or hear, shouldn't say talk, but we often hear about the government healthcare system. You know, we already have somewhat of this through Medicare and Medicaid, but what are your thoughts on a fully run government system?
Flip it back to you, Mike. So, when have you ever seen the government run anything exceptionally well,
Well, the
right?
IRS does it all the time. What are you talking about?
And even and let's look to Canada, right, or the UK, right, which has socialized healthcare plan. And at the end of the day, what you typically see there, and I know, people like getting their care, but they have to wait on average 3 to 6 months to get an appointment with a specialist, right? When you have a problem, when you have an issue, you need to be taken care of now. You don't have that
Yeah.
time, that luxury to wait. And so, right, many people in those countries that can afford it, they actually have separate buy-up plans, like the United States, with their offerings to get the kind of care and access they need. But if we went to that kind of system, I think it would be very challenging. But on the reverse flip side, right? If companies continue to put their head in the sand and have that claims cost creep, premium creep continue for the next couple of years, you get what you ask for, right? If you do nothing, who knows? We may go to something like that. But there is a subset of employer groups that are active, that are engaged, that are digging in, that are educating their employees, and they're really making a difference. And their plan spans, right? They are running significantly less than other companies because they're taking the right approach. And their opportunity, right, is limitless.
Yeah, and you know what? When you're talking in the dealership world, that that $1,000 of savings that you're making in your healthcare plan can be used to offset the gross on one car deal by $100 and make the deal happen versus a competitor down the road.
Absolutely. Think about this, right? How many more cars do you have to sell to make
Oh,
$2,900 that you just gave away, right? And when you look at the
well, that
profit per
depends
car.
on if it was pre-COVID or during COVID or pre-COVID or after COVID.
Right. And even now, right? There's
Yeah.
a lot of seesawing with the tariffs and it's, people a little continued uncertainty. Companies really need to look at their expenses more closely. And this is one of those items. And so, frankly, I urge every single dealer executive, don't just leave this only to the HR. Yes, they can manage it. Don't just
Yeah.
leave this only to your broker advisor. Sit in those meetings, ask questions, get the data, have an analysis done. This is a real area of opportunity, especially with the challenges and the uncertainty with the economy today.
Okay, awesome. Well, Keith, we're at our pretty close to our time, so it's been a great discussion and some great ideas on the self-insured. So, any final words of wisdom that you can provide our customers?
Yeah, I'd say this, right? A runaway expense will continue to just be a runaway expense. A managed expense is one that you pay attention to. We see more companies pay attention to papers, pencils, and paper clips and travel expenses, which are de minimis in comparison to healthcare costs. So I urge employers to really raise your hand, sit in, as I mentioned, and pay attention and really use that employee benefit, right? The group health plan for retention, growth, culture enhancement, as well as improved profitability.
Awesome. So, Keith, that concludes our month's episode of Up to Speed. I want to thank you for being here today and giving us some insight into the health insurance and ways to build a stronger workforce as well as reducing the healthcare costs at the dealership.
Great. Thanks, Mike. Thanks for having me.
Yeah, it's been great. So, to our audience, thank you for joining us today. If you have any questions for Keith, his contact information will display on the screen. Feel free to reach out to him directly. We look forward to seeing you on our next episode. And remember, we arrive in your mailbox the third Wednesday of every month. And you can also visit us at our website at bakertilly.com/dealerships to view up to speed episodes. Until next month, make it a great day.